Okay, last time we have seen about the ICU, whether ICU should be in a private room or it should be into an open room. Now we will see about the design and layout of the ICU rooms. The design of ICU should take into consideration the integration and smooth functioning of following three areas. Ideally, as we have seen, basically in an ICU, there is a lot of collaborative work amongst the team members. So, each ICU has three differentiated areas which has to be in close consideration and in good coordination so that the operations of the ICUs are running smoothly. These three areas are the patient area, the staff area, and the support area. So these are the three important areas. We divide the ideal ICU or design or layout into these three areas. That is the patient area, staff area, and support area. Now, for designing the ICU, we should have the basic consideration. That is, the basic consideration are the direct observation of patient should be by nursing and medical staff. As we have seen, the criteria for admission in an ICU is basically those patients who are critically ill, whose vital signs are fluctuating, it's not stable, so they have to be continuously monitored. So ICU design should be in such a way that the patients are all the time closely monitored by the nursing and medical staff. So it should be like the nursing station should be in the centralized so that the nurse can see all the patients at a time. Surveillance of the physiological monitoring, that is what, even though the monitors are attached nowadays, monitors are attached to the ICU beds, but the thing is that if any alarm is there in a monitor, that should be captured at an instance, because as we are mentioning again and again, these are the area where the critical ill patients are admitted, and if prompt services are not given, if it is not captured at a time, it can prove fatal for a patient. So it would have an impact on the hospital image. So basically, if anything goes wrong in an ICU, that can be an very gross mistake which has to be paid by either the patient's life, and it would create a lot of bad image for the hospital name. So that's why the surveillance of physiological monitoring should be continuously there. Provision and efficient use of routine and emergency diagnostic procedures and therapeutic interventions. So basically, in an ICU, once what happens in an emergency, once the patient is stabilized, when the patient is coming to an emergency department, his vital signs are recorded, and if his vital signs are not stable and it's fluctuating, then basically initially treatment would be started, but at the same time we don't know what is the cause of this. So diagnostic procedures like basic diagnostic procedures like the pathology test, the CT, MRI, it has to be nearby or closer to the ICU department. And even if any major intervention has to be done, that's why if any intervention has to be done or therapeutic treatment has to be given, that has to be also very closer. That's why initially we have said, when we said that the ICU should be on the ground floor and it has to be close to the CT and MRI, and at the same time it has to be close to the OT department, because if any surgical intervention is needed, then the patient can be shifted to the OT at an instance. The other reason is also it has to be closer to the OT department. That time also we have discussed that when we have categorized the patient, the first category of patient, like those patients who have gone through the major surgery, whose vital signs are stable, but still they have to be admitted in an ICU so as to they can be closely monitored or observed for certain duration of time, so that if any complication arises, that has to be taken care of at an instant. So even for that matter, since the complication of surgery, it has to be closer to the OT department. That's why this is the point which has to be taken care of, that it has to be closer to the diagnostic procedures and therapeutic interventions. Recording and maintenance of patient information. So all patient information, it should be continuously recorded, and it should be continuously monitored, and it should be recorded. So nowadays, when we say the recording and keeping a record of the patient information and maintaining it, that is done by the monitors itself, which are directly attached to the ICU bed. But besides that also, if any manual technique is done, or if any manual diagnostic procedure is given or done in the ICU bed, that has to be recorded in an indoor case paper. That is the trend that has to be followed by the nursing staff. If anything is done for the patient, that has to be recorded over. Even for that matter, there is a policy and protocol related to the coordination and communication. Even if any drug which has been added of, or which has been asked to remove from the dose by the consultant, it has to be written on the record in an ICU case paper. So that's why it's very important that all a recording and maintenance of patient information, all patient information related to the disease has to be recorded and keep maintained. So that is a very important criteria. So these are the basic consideration which has to be considered while designing the ideal ICU layout.